Every day, more than 130 people in the U.S. die after overdosing on opioids. The misuse of and addiction to opioids is a serious national crisis, but this weekend you can help make sure your prescriptions don't end up in the wrong hands. And joining us today is Dr. Don Stater from Health One Hospitals, and he's an emergency room doctor. Thank you so much for being here.
Thank you for having me.
Kind of paint us a picture here, as working with emergency medicine, how big this opioid crisis is.
Oh, this is one of the biggest public health epidemics we have ever had in this nation. And there does not go by a shift in every emergency department where we don't see some of the ravages of this epidemic. And patients who have overdosed, patients who have an addiction problem, who come in looking for help, or patients who are struggling with chronic pain and are saying, you know, I'm on too high a dose of this drugs, I'd like to either wean down.
Yeah, and so they're able to kind of relay that information to you, like I'm on too high of a dosage here.
It's been amazing. As the public knowledge of this epidemic has grown, more and more people are saying, you know, I want to come down off the opioids I'm taking, or, you know what, after my surgery, I'd prefer that you don't prescribe them to me.
What are some of the things the Health One hospitals are doing to fight this epidemic?
The first thing that we're doing is we're trying to be judicious about limiting the amount of opioids that we give out, especially for conditions that don't require an opioid. And just in our emergency departments, we've had a 75% reduction of opioids that we've given out over the past 3 years, which is pretty remarkable. The other thing is when patients come in, they have a full-blown addiction, and they might be at risk for overdose. We're actually sending those patients home with a life-saving drug, naloxone. And the last thing, at Swedish and Aurora, we started new programs where when patients come in with an addiction, they say, I want treatment. We're actually giving them treatment right then and there in the emergency department, and then connecting them to addiction specialists when they leave the doors.
And even if you're not addicted, you can help this weekend. Talk about the Drug Take Back program.
So one of the things that every individual can do is look in your medicine cabinet. And if you have opioids that are left over from a past surgery, etc., those actually represent a danger to your family and especially to children. So we'd prefer that you get those out of the medicine cabinet and dispose of them by bringing them to one of our Health One facilities and getting that dangerous drug out of the house.
All right, Dr. Don Stater, thank you so much for being here from Health One Hospitals. You can anonymously drop off your medications for safe disposal this Saturday from 10 to 2. Crush the Crisis is what it's called. Events are going on at 5 Health One locations across the metro. You can get all the details at healthonecares.com/crushthecrisis.